Hi guys, how are you guys doing today? So for today's video, I'm going to show you guys how to actually drain and do a dressing on a Pleurex drain. So a little bit backstory: patients that would probably have a Pleurex drains, or those that are cancer patients that have continuous pleural effusion. So these patients, they might go home and they can do like the Pleurex drainage themselves, or when they come to the hospital, we get to drain the Pleurex for them. Always make sure that you're looking at your physician's order just to see how much of the fluid you need to drain out. Not only that too, but how often should you be draining the patient, okay? So this is my patient here to do the actual Pleurex drain. As you can see, my patient already has an old dressing on, and I also have my kit right here. The kit should pretty much have everything that you need, including the dressing, anything to clean the skin. It's on here for you. I have regular gloves because to remove the first initial dressing, I'm just gonna use regular gloves. And you always want to clean your hands, so I have some hand sanitizer here. I have my marker because you always want to put the date and time after you do any dressing change. And I brought some Chlorhexidine and gluconate patches, only because let's just say my patient was really dirty, they were soiled. I would want to clean my patients before I remove the old dressing. Okay, so let's go ahead and get started. The first thing that I'm going to do is I'm going to go ahead and do hand hygiene. I have my hand sanitizer. I'm going to go ahead and clean my hands. So once I'm done cleaning my hands, I'm going to go ahead and grab my gloves. Come a little closer. So what I'm going to do now, as you can see, I'm going to go ahead and remove the old dressing. There's a tegaderm on top of the old dressing, so I'm going to just go ahead and remove that. As you can see, you always want the catheter to be inside of the dressing and not laying out. I'm going to go ahead, remove my old dressing. That's going to be garbage. And I'm also going to go ahead and, of course, this is not the actual catheter that is used, but for education purposes, I'm going to go ahead and use this one because the original one that we use for actual patients is really expensive. So I'm going to go ahead and remove all my dressings, throw that in the trash. You always want to assess the patient's skin just to make sure there's no excoriation or anything like that, so you can do a good assessment of your area. Then I'm going to go ahead and clean my hands one more time. All right, so once I'm done cleaning my hands one more time, I'm gonna go ahead and grab my supplies. As you can see, this is already open because that's one that we've used before, only because for education purposes, I don't wanna waste materials. So this for you will be a brand new one. You never wanna reuse any used catheters on a patient. So for education purposes, this one's already open, but we're gonna go ahead and open it. So I'm gonna go ahead and grab my supplies. Okay, I have my kit, and of course I like to leave the catheter inside already. And this is gonna be my dressing for the patient. Okay, so I'm gonna go ahead and open. I'm gonna move away from you on the sides and go ahead and remove towards you. Okay, so as you can see in the package, I have some alcohol wipes, I have some gauze, some dressing, and also some sterile gloves as well. And I also have a clamp in there to be able to clamp for any emergency situation. So I'm gonna go ahead and grab my gloves. I'm gonna put on my new gloves. Come a little closer. All right, so with my gloves, I'm gonna go ahead and make sure I have everything that I need. As mentioned, I have my alcohol wipe, and I also have a clamp here because you always want to change the clamp when you're done. All right, so I have my new my alcohol wipes. I'm gonna go ahead and wipe the skin. You always want to use everything that's on the package. Second one, I'm gonna clean the skin. Third one, I'm gonna go ahead and clean the skin with the third as well. Make sure everything is nice and clean. Once I'm done cleaning, I'm gonna go ahead and actually now drain the patient, right? Because what I'm gonna do, I have my drainage catheter here. So a little thing about the catheter, as you guys can see, it has measuring It has measurements in it, and it also has this little clamp that I can remove. To grab suction, I'm gonna have to push down on this to be able to grab suction on this bottle because it is glass. So I'm gonna go ahead, make sure that I am putting this on the flat down, remove the little covering, and what we would have done is just put it straight through. My clamp is already clamped before I even open it, and like I said, you want to make sure this is pressed down and slowly open my clamp. Of course, you're not going to get any output on this because it's not a real patient, but you can get a good thing on the clamp. We're going to open the clamp, and then you'll be able to get suction from there as well. Okay, you never want to drain more than 1,000 cc's, and you always want to follow your physician's protocol. Let's just say the patient wasn't putting out much in a day. You can always talk to your physician to see, instead of draining the patient daily, maybe you can do it every 2 to 3 days. Okay, so once I'm done draining the patient, I'm gonna go ahead and clamp, and then you're gonna detach. And at this point, you would have gone ahead and insert your new catheter on the patient. Of course, this is not a real patient, so it's not gonna stay, but you would attach the new cap. Like I said, I already cleaned the patient. If I have extra alcohol wipes, it's always good to clean it again, but I already cleaned around the area. So now what I'm gonna do is I have this dressing that I'm gonna go ahead, put it around my patient to cover my catheter. Okay. I always like to bring the catheter inside. Of course, it's not a real catheter. It will have a cap in it. Then go ahead and cover it with just a regular dressing. And then with my actual Tegaderm, because you don't really use tape, I'm just gonna go ahead and cover. Gonna cover. You come a little closer. You can move with me. Okay. Okay. All right. Just remove. Put this in as much as possible. All right. Gonna go ahead. Usually with these patients, one Tegaderm should fit for the patient, but of course I didn't want to use the actual real Tegaderm that goes on there because it's expensive and we don't want to use that. So this is just regular Tegaderm that I'm just gonna put over it. And this is how you would go ahead and dress it. And of course you go ahead and put your date and time. Today is the, let's just say today is the 26th. NPR, right? I would have my date and my time on it. Sometimes I like to cover with another piece of tape so that way that doesn't get smeared. And just so you know, this whole bottle is gonna go in your biohazard bag and you're going to throw that away after you go ahead and document your measurement. Okay, remove the old gloves and then wash your hands, and that is it. All right, I love you guys. Just remember, wherever that you are nursing, there's no one that could do it exactly like you can. All right, love you guys.